In this video, we answer the question that so many people on Medicare ask: what if I choose a Medicare Advantage plan first and I later want to switch to a Medigap plan? Coming up next on Holy Schmidt.
Holy Schmidt!
Over half of Americans over age 65 are on a Medicare Advantage plan. Yet those that are on a Medicare supplement, a Medigap plan, routinely say that they would never engage in the risk or the hassle of having a Medicare Advantage plan. So who's right? The answer is that these are two fundamentally different ways to manage healthcare costs in retirement, and reasonable people fall in both camps. But here's what this video is all about. What happens if you're in the Medicare Advantage camp and you later want to switch? Because the act of switching has pretty significant consequences, and a lot of people don't see those consequences coming. In this video, I'm going to answer that question. And at the end, I'm also going to give you information about the states that have guaranteed access, so that if you want to switch from a Medicare Advantage plan to a Medigap plan, you can do so with no underwriting. All right, let's go. Point number one. With a Medicare Advantage plan, you lock in your underwriting risk later. When you turn age 65 and you enroll in Medicare Part B, you receive something quite valuable: a guaranteed access right to a Medigap plan with no underwriting, which means no price hikes. This guarantee is for 3 months before you turn 65, the month that you turn 65, and 3 months after you turn 65. There are exceptions if you're still working, but that's outside of the scope of this video. It's important to note that this window is temporary. If you choose a Medicare Advantage plan at 65 and you later want to switch to a Medigap plan, in most states, they can ask medical questions, which means that you can be turned down or your premiums can be increased. But here's the important point to note. People rarely switch plans when they're healthy. They switch when they've received some sort of diagnosis that their plan either doesn't cover well, or they don't have the doctor or the facility on the plan that the retiree wants. And it's the worst possible time to be exposed to underwriting risk. Importantly, though, there is a 12-month trial window if you sign up for a Medicare Advantage plan and within 12 months you decide you want to go back to a Medigap plan or go to a Medigap plan. You have the right to do so within the first 12 months of going on Medicare. After that, the 12-month window is closed. Medicare decisions are rarely about your healthiest years. They're about the years where you need coverage the most. And when that moment arrives, the last thing you want is underwriting standing between you and the plan you need. Gang, Medicare can be confusing. It can be overwhelming. Ask anybody who's age 65 or older, and they will tell you that this is true. People will spend hours of time analyzing Medicare plans, and they think they've selected the perfect plan, only to find out that their selection has cost them hundreds or even thousands of dollars a year. On this channel, we have only 3 affiliate relationships. One is our trusted Medicare partner, Chapter. Chapter is the only national advisor that looks at and recommends every plan nationwide. They're totally free to you. They save their clients an average of $1,100 per year, and they certainly won't put you in any plan that you don't want. The best part is that they're really easy to work with. If this is of interest to you, give them a call at 440-703-1224 to see if they can help. Point 2, your cost structure shifts from premium heavy to usage heavy. Let me explain. When you choose between Medicare Advantage and Original Medicare plus a Medigap plan, you're not only choosing between types of plans, but you're also choosing between cost structure. With Original Medicare plus a Medigap plan, your costs are premium heavy. You pay for the Medicare Part B premium, you pay for the Medigap premium, and you pay for the Part D drug premium. With a Medicare Advantage plan, sometimes the costs are zero outside of the Medicare Part B premium, and your costs are when incurred. And I'm talking about deductibles, coinsurance, and maximum out-of-pocket. Most Medicare plans do have a maximum out-of-pocket. In 2026, the federal limit is $9,250. But here's what people don't fully understand about that number. There's an additional $2,100 for drug charges, which increases the limit to $11,350 on some plans. For retirees living on a fixed income, the difference matters. You're not just deciding between a zero premium plan or a plan with $180 a month or $200 a month payment. You're also choosing how your healthcare costs are going to play out in the months and years ahead. Point 3, your Medicare Advantage plan operates as a network-based system. When you enroll in a Medicare Advantage plan, you're enrolling in either a HMO or PPO structure most of the time, not full access to all doctors, or most doctors anyway, in hospitals across the United States. Within an HMO Medicare Advantage plan, all of your care is within the network. Your primary care provider is in the network. Your specialty care providers are in the network. The only time you can go outside of the network is in an emergency. With a PPO type of plan, it's better, but if you go outside of the network, your costs are generally higher. Many Medicare Advantage plans require pre-authorization. That means that if your doctor wants you to have a test, treatment, or some sort of procedure, the insurance company needs to approve it first. Original Medicare plus Medigap plan doesn't have this restriction. Here's a point that puts this all in perspective. According to GEOFF'S, someone who has a Medicare Advantage plan, if their claim is denied 80% of the time, it's subsequently approved on appeal. This means that people go through a lot of frustration that those on a Medigap plan don't have to go through. Here's the other structural difference between Medicare Advantage and Original Medicare plus a Medigap plan. A Medigap plan allows you to see any doctor that accepts Medicare, and that's about 95 to 97% of the doctors out there. And of course, with a Medicare Advantage plan, you are limited to those in your network in most cases. The difference matters in real-life scenarios. If you travel a lot, or if you spend part of your time in one part of the country that has the Medicare Advantage network, in another part of the country that doesn't have the network, you're exposed. Also, if the doctor that you like leaves the network, you no longer can see that doctor. The third point is if you develop a medical condition that requires specialty care outside of your network, or a doctor that is outside of your network, you're going to be faced with limited options. Most people compare plans based on premium. Very few compare plans based on access. And that makes all the difference in the world for a lot of people. Point 4, your plan can change every year. Medicare Advantage plans are contracted with the federal government. The insurance companies are contracted with the federal government. And doctors, hospitals, and other providers are within the scope of the contract. Same thing with the medications that are covered by the plan. And every year, the insurance company can change this, along with deductibles, co-pays, and co-insurance. So you're not protected with what you signed up for in the years ahead. This doesn't mean that Medicare Advantage is unstable, but what it does mean is that you need to actively manage your plan every year. Original Medicare plus the Medigap plan have far more consistent access, but you need to watch for premium changes with that particular type of coverage. Medicare Advantage plans offer both opportunity and responsibility. They offer opportunity because sometimes the insurance companies improve the coverage. They want to increase participation in an area, so they offer things that they didn't offer the year before. But it also creates a responsibility because the insurance company is the one that makes the decisions about the providers and the other offerings within the plan. And so you, as the Medicare Advantage enrollee, need to understand that you need to look at that plan every year and, if necessary, make changes during the annual enrollment period between October 15th and December 7th. The bottom line is that the plan brochure that you saw and you signed up for at age 65 is not guaranteed coverage for the rest of your life. That coverage can and probably will change in the years ahead, and so you need to monitor this to make sure that the coverage that you need is still the coverage that you have. Point 5, how these risks compound over time. Now, each of these 4 constraints that we talked about before seem manageable on their own, but when you combine them, they start to become a lot more volatile and a lot harder to work with. At age 65, you have the widest amount of choice in front of you, and you can make any choice you want without health barriers. But that does change once you start Medicare. And sometimes the choices that you could make at age 65 don't exist at age 75. As the years pass, a few things happen simultaneously. The first is that your health picture may change, and if you were to switch, you now face underwriting risk. The second is that you may grow comfortable with the providers you're using, and if they're no longer part of the network, you have to start over again. These and other issues are some of the things you need to pay attention to with a Medicare Advantage plan that you don't need to pay attention to with a Medigap plan. Geography adds another layer. If you decide to move, your providers don't move with you, so you have to start over again. And some of the benefits that existed in one part of the country may not exist in another part of the country. And when you contrast that with original Medicare plus a Medigap plan, you don't have the constraints of the network. So even if you do move, your choice is much larger than a Medicare Advantage plan. Medicare is not a one-year decision. Sometimes it's a lifetime decision, and that decision sets the path for your options in the future. Supremely important that you understand this when making the choice of a Medicare Advantage plan or a Medigap plan. Now here's the good news that I promised you at the beginning. There are some states that don't require underwriting. They go beyond the federal limits, and the states have stepped in and said, if you want to operate in our state, you need to do it our way, which means that we want our retirees, 65 and older, to have access to a Medigap plan at any time without underwriting. Connecticut and New York both require insurers to sell Medigap year-round without health questions, regardless of your current plan or health status. If you live in either of these states, you can switch from Medicare Advantage back to original Medicare plus a Medigap plan at any time, no underwriting required. Massachusetts requires a guaranteed issue window from February 1st through March 31st each year, but in practice, all insurers in the state currently offer continuous open enrollment year-round, meaning you can buy Medigap without underwriting at any time. Maine guarantees access to Medigap Plan A, the most basic plan, during a designated month each year. That creates a limited real annual opportunity if Plan A meets your needs. There's also something called a birthday rule state, which means that if you have a Medigap plan and you want to switch to a plan with less coverage, you can do so on or around your birthday. For example, if you have a Medigap Plan G and you want to move to a Medigap Plan A, you can do it using the birthday rule around your birth date. States with birthday rules now include California, Idaho, Illinois, Kentucky, Louisiana, Maryland, Nevada, Oklahoma, Oregon, and newer additions include Delaware, Indiana, Utah, Virginia, and Wyoming. The list has been growing, so it's important for you to check your state's current rules to see if they are added to the birthday rule list. Outside of these states and federal protections, insurers can medically underwrite you if you move from a Medicare Advantage plan to a Medigap plan. Now, what we just talked about answers the question, what happens if you choose a Medicare Advantage plan first? But there are conditions where a Medicare Advantage plan might be appropriate for you. A Medicare Advantage plan can be a great fit for someone who wants lower monthly premiums and is comfortable managing copays as they use care, who is comfortable using a defined provider network and does not need broad national flexibility, and who is willing and able to review their coverage carefully each fall. Many of these plans include benefits that original Medicare plus a Medigap plan simply don't offer. Things like dental, vision, hearing, transportation, meal delivery in some cases, and over-the-counter allowances. The important point here is not to decide which camp is right. Both can be legitimate. But what is important is for someone who's choosing a Medicare Advantage plan to understand what the risks and limitations are in the future. The biggest one, of course, is that if they want to switch, they may be faced with medical underwriting. If you like this video, check out that video, Why Waiting to Retire at Age 65 Could Be a Big Mistake. Also, if you have questions about Medicare, don't forget to give our partner at Chapter a call, 440-703-1224. This is Jeff Schmidt, and I will see you in that video right there.